Hello, everyone. Happy Thursday. I hope you're all staying safe out there. It looks like some pretty nasty weather, so please pay attention to the local weather forecast and seek shelter when you need to. So, I'm Rendi Murphree, epidemiologist and director of disease surveillance at the Mobile County Health Department. And per normal, I'll read some figures from local sources of information on the number of COVID-19 cases or deaths. Sorry, that was a really loud thunder and it startled me a little bit. All right, worldwide, we have nearly 2.7 million confirmed cases with over 180,000 confirmed deaths. In the United States, just over 842,000 confirmed cases with 41,000 or so deaths. In Alabama, the real-time dashboard published by the Alabama Department of Public Health this morning was reporting 5,654 confirmed cases with 197 COVID-19 deaths. And for Mobile County this morning, the public dashboard was reading 783 confirmed cases with 38 reported deaths. We often, every day, our report includes the number of total laboratory tests performed. And I just want to comment on this number that we know the number of total laboratory tests is a gross underestimate of the true number of tests performed. There are, thank you, Mark. Hi again. We know that there are a lot of laboratories that are not able to report negative test results electronically. And though the Alabama Department of Public Health is working to bring electronic reporting on board, I found out from them yesterday that there have been over 140 unique laboratories who have reported COVID laboratory results to the state. So you can imagine that this is no easy feat to try to get every one of these 140 some laboratories reporting not just their positive COVID results, but also their negative COVID results. Those that aren't able to communicate with us electronically have to manually enter every negative result, and that is delayed by a great deal. So please keep that in mind when you are considering how much value to give to that number of total labs conducted. So I just want to read a statement put out by the Alabama Department of Public Health today. We've been talking a lot about the change in the way deaths are reported, and I want to read this statement verbatim. Our dashboard and table now lists one death category, COVID-19 deaths, instead of two. Last week, the CDC's National Vital Statistics System provided updated guidance regarding reporting COVID-19 related deaths. The criteria for COVID-19 death counts now include people who died with a positive COVID-19 laboratory test, as well as individuals whose death certificate lists as the cause of death COVID-19 or an equivalent. As expected, the numbers moved closer to the reported deaths count, and cases increased in some counties as part of the update. Most of these change in numbers are due to cases that have died but were not previously marked as died from COVID-19. So as I've reported, before this change, Mobile County death rate was around 2.5% to 3%. And due to this change and more rapid recognition and reporting of COVID deaths, among the 760 or so COVID-19 patients we have, around 93% or 93 or 12% of those have been hospitalized, and 38 have died from illness. So this puts our death rate at 5%, which is almost twice as high as we were reporting last week. And again, we don't believe this is because we have suddenly had a lot of new deaths in the last couple of days. This is partly due to the change in the way deaths are recorded, that we are now caught up with classifying our deaths as being related to COVID disease. So I've mentioned before, but I'll say again today that Most of the cases occur in people aged 25 to 64, but we still have 23% of our cases in the 65 and over category, and those are the ones that we worry most about with regard to severe complications. Most of our cases are female, so around 60%, and 43% are African American and 30% are white. And again, we're still reporting out by zip codes that have at least 20,000 population. And I don't have the colored zip code map with me, but if you check our daily report online, you'll see that density map that shows where the zip codes where we have the most cases. Let me just mention a little bit more about the people who were hospitalized. 9 were between 25 and 49 years old, 29 between 50 and 64, and 55, so more than half of our hospitalized patients are among those that are 65 and older. And for our deaths, again, we are reporting today on 38 patients who died from COVID-19 illness. And let me look. They're between the ages of 52 and 83. Most of them are male, and about 2/3 of them are African American, and the other third are white. So let me move on now to, we have a coworker of mine, Becky, is going to come and talk to us about, I'm going to get this right, nutrition services, and then I'll come back online to answer some questions. Becky?
Thank you, Ms. Rendi. Good afternoon. My name is Becky Light, and along with Clarice Lee Perkins, we are the dietitians here at the Mobile County Health Department in Nutrition Services. We provide nutrition education on many health problems that you may have, such as diabetes, high cholesterol, high blood pressure. If you are one of our patients here at the health department, we are here for you. We are providing all patients with telehealth nutritional counseling sessions in which we will be calling you to schedule an appointment to talk with you over the phone, or we will leave a message for you to call us back. Now, the numbers that you can reach us, because you're also welcome to call us, are 690-8843 as well as 690-8828. Again, the phone numbers are 690-8843 or 690-8828. Thank you, and we look forward to talking with you.
Thank you, Becky. And maybe I'll also just remind you all that Family Health, the primary care division of the Mobile County Health Department, is now offering COVID-19 testing for those who meet the criteria in our parking lot here at the downtown location at Keeler for anyone who fits the criteria and is not able to get a test elsewhere. So you don't have to be a patient of ours. We will provide that to you. It's at no cost to you. We'll bill your insurance if you have insurance, and if not, we'll take care of you anyway. And you have to call for an appointment, and that number is 251-410-MCHD, or that's 251-410-6243. We're not open today because of the weather, but we will be open tomorrow. You can still call and get your appointment. We have not had long lines, so please, if you feel unwell or if you have an illness that is just not resolving, please give us a call so we can provide you with that information. And then stay at home when you're sick until you're well. All right, I'm going to answer a couple of questions that I have here. Some of these were from a day or two ago since we didn't have our live update yesterday. Here's a question. Can you tell us why Mobile County has so many more cases of COVID than Baldwin? Why have we surpassed Jefferson County in confirmed cases? And I do not know why that is the case. We will continue to look at our demographics. We really try to focus on our cases, but it is important to look to see how we compare with other counties and other states. You know, if you have looked at the public dashboard on alabamapublichealth.com, you will see that we're hovering right around 115 cases per 100,000 population. And Jefferson County is slightly lower than that, but there are some other counties that are 5, 6, 7 times higher than we are. So take a look at that rate map on the public dashboard, and it'll give you the fuller context of what's going on around the state. I'd like to know if two individuals have been told they are negative for coronavirus but are positive for antibodies, are they allowed to have sex? Should they be continue to be quarantined? So the antibody test, again, only measures for the antibodies or the cells that your immune system produces in response to an infection. A positive antibody test does not mean that you have active infection. You would have to have a PCR test in order to determine that. Having said that, there's no reason to think that coronavirus is transmitted through sexual contact unless you are, one person is infected and you're touching your face or eyes. So just through sexual intercourse, we're not having transmission of coronavirus that way. It is still person to person through your mucous membranes. So yes, stay quarantined if you're sick. Let's see. I've been listening and following all the coverage of COVID-19, noticed concerns with long-term care for seniors. Then I talked about apartment complexes on Tuesday. And a viewer is concerned about individuals with disabilities living in group homes. So yes, the same information applies to group homes. We would consider that a congregate setting. So when I talk about nursing homes, long-term care facilities, detention centers, that also applies to group homes. And yes, if we know that some group homes have medically fragile residents there, so we want you to be extra precautious when implementing the stay-at-home order and the social distancing, the physical separation between you and other people who might be living there. It's super important for you to follow that advice if you're living in a group home. Let's see, that one I've already answered. I think I've already explained about deaths. That's another question. Here's another question about deaths. Have any occurred outside of the hospital or all of them occurring inside the hospital? The overwhelming majority of deaths that we know about have been attended. So that means they've been in a hospital when they died. Those ones we hear about faster because the attending physician can certify that that death was due to COVID, but usually we already have a laboratory result, right? If they don't have a laboratory result, let's say they die outside of a hospital, the determination at post-mortem, if it's a COVID-related death, takes a longer time. Specimens have to be collected and submitted and tested, and then the certification of that death certificate takes longer. I only know of a couple of deaths in Mobile County residents that had no explanation that we are evaluating to see if it's related to COVID. So stay tuned to that. We will just include them with all of our deaths, not parse those out, but the overwhelming majority have died in the hospital. Here's a question. I know you can't tell me the facilities where clusters have occurred, but can you tell me how many nursing homes and other institutions have reported deaths and cases? So we have cluster investigations going on in about at least 6 locations where we have COVID positive residents or COVID positive staff. So we do have at least 6 cluster investigations going on around the county. Here's a question about the death rate. The fact that our death rate is a little bit higher than Jefferson County's, does that mean that people are not social distancing? It is a concern. This is a health professional that's written in to say, as a health professional, this is very disconcerting. Is it that people are not following social distancing, hand washing, wearing of masks in public? We still have very small numbers of deaths. Many of our deaths we know have occurred in congregate settings, so that the outbreaks, the clusters that we have had several deaths reported. I believe one of the nursing homes released that information directly to the public. So that could be a reason why our numbers are slightly higher, is because we have had deaths related to outbreaks in congregate settings. So those are my comments on that. Let's see. update on nursing home facilities. So I've said about all I can say about that. One thing about nursing home facilities that I will say, you probably saw a news release by the state health department that said that she's mobilized the National Guard to provide disinfection in nursing homes. And so we are very pleased that there is a National Guard unit that is providing those services in Mobile County. They are out and about and starting to do some of that work, so we're really happy about that. This does not alleviate the nursing homes activities and disinfecting them on their own. They are contracting with professional companies to do this as well, but we're happy that we have an extra layer of disinfection provided by the National Guard. So thank you to the governor for activating those units. We are continuing to consult on a daily basis, sometimes multiple times a day, with the 6 or so facilities that we have outbreaks in. So we have lots of questions about this. You guys know I can't give you any details. If the facility themselves decide to release information directly to the media, they of course can do that, but I can't give you the details. But please know that we are talking with them every day. We're supplying them personal protective equipment when we have it available. We're helping them with test kits if they run short and we have some available, and we're consulting with them almost every day. And this is a question here. What is your reaction to Katie Ivey's order to keep the stay-at-home order in place through April 30? I think that's the smart thing to do. We don't think that we're leveling off or have hit our peak. The number of cases that have been reported over the past couple of days is hopeful. Every day it's been between 20 and 50 cases, so that is hopeful that maybe the number of cases reported by day is going down, but it will take some more time before we can see if that is sustained or if it begins to decline. And again, we have to go many weeks with a steady decline before I, as a public health official, can start to recommend lifting restrictions. But those decisions are not up to me. It's up to the governor and our public health official, our state health officer, and our local public health officer, Dr. Bert Eichel. All right, just a couple of more questions. I'm going to try to get to all of them. And Mark, did you have one from Facebook that you wanted to grab?
A few. Has testing increased? Can you share daily testing numbers?
Has testing increased? Yes. The availability of testing has increased. The timeliness of test results has greatly improved, but I do not know the total number of tests provided. There is a number on the public dashboard on alabamapublichealth.gov, but I don't repeat it because I don't believe it to be true. I know that it is an enormous underestimation of the total number of tests.
Okay. You mentioned senior centers. Are there any other hotspots in the county?
So I mentioned nursing homes, long-term care facilities, or detention centers. We have had some scares at apartment complexes. So luckily, most of those have turned out to not be true. But right now, we have about 6 or so outbreaks in long-term care facilities or detention centers. And go ahead.
Last one. About the number of cases recovered people, how?
Okay, so the question from Facebook is, do we know how many people have recovered? I hope that I will be able to provide you some good data on the number that have recovered next week, but I can't do that now. We have about 10 disease investigators that have been working on trying to keep up with investigating the cases that are reported to us. So when we get a notification about a positive laboratory result, we reach out to contact that patient and conduct an interview and find out about their close contacts and provide them with information about isolation and quarantine, all of those things. That has taken up so much of their time that we've not been able to call back our earliest cases to find out if they've recovered, if they're still ill, if they've been hospitalized and we didn't know it, or if they've died and we didn't know it. But this week we mobilized an additional team of people to begin calling, going back way back to our first case reported on March 19th, to contact all of those folks, check in with them, see how they're doing, answer their questions, and try to determine if they've recovered or if they're still ill. So we're going to try to get all of that data compiled over the weekend, which means I'm going to be working very hard this weekend to try to provide that information to you early next week. So stay tuned about that. So I'll get back to these. Are we requiring hotels, motels to disinfect rooms? There is guidance information for disinfection in hotels, motels, businesses, and your homes, but that is not something that has to be inspected or reported to the health department. Why have fast food and other restaurants not required their employees to wear face masks? We have strongly recommended the wearing of face coverings in all retail settings, including restaurants and fast food, but it is up to those proprietors to decide if they are going to require that for their employees. We strongly recommend it, but we have not issued any directives that would require that. With talks returning to opening, is it too soon? There's no cure, there's no approved treatment other than managing symptoms, and there's no vaccine. So I think you've just answered your own question that yes, it's too soon, because we don't have a cure, we don't have a treatment other than symptom management, and there is no vaccine. Could we see a second wave if we return to normal operations too soon, and a third wave in the fall, assuming there's still no vaccine? Yes. History has taught us through the 1918 pandemic that that we could see second and third waves of illness if we are not able to slow the spread. And even if we do slow the spread and delay the height of the curve so that our healthcare facilities do not become overwhelmed, we still could see a second wave. We just hope that we'll be able to, again, keep that second wave as small as we can using some of the community mitigation measures that we've implemented. Let's see. Somebody's asking about the chart that I published that's based on illness onset date, that it looks like some good news that it's been decreasing almost daily. Can I sort of elaborate on that? So try not to take too much certainty from that chart, because again, we hear about the positive lab, and then we do the interview after the fact. So any of those cases that have been reported to us over the past couple of days, 4 or 5 days, we likely do not know yet if they are sick or when they became sick, and that they're not included in that curve. So that's why it might artificially look like the numbers have been going down in the last week, because we've just not had time to interview those most recent case reports. Let's see. We talked already about deaths. I think I don't have to talk anymore about why we changed to a single number, that we changed to a single number, and what the definition now is for death. So someone asked about, are we now counting deaths the way they're counted nationally? The answer is yes. More about deaths. The good thing about the fact that we have 5% deaths among our cases is that means that 95% of people with COVID disease survive. And the even better news is that we have 12% or so that are hospitalized, which means that 80 to 90% of people who get COVID disease are able to manage their illness at home. So those are really helpful things. Again, those severe complications that require hospitalizations and deaths are in people 65 and over, or who have underlying medical conditions at any age. So those are the folks that we want to be very sensitive about. If you start to feel ill, contact your healthcare provider soon rather than waiting.
Are there any industries trying to protect the families of essential workers? I have lupus and my husband has to work. What can I do to protect myself?
So the question is about if you have an essential worker in your household that is continuing to work, but you have an underlying medical condition, or you're at an age that makes you subject to severe complications should you get COVID-19. So if you're, like in my situation, my husband is a musician and works from home. I'm out in the community every day. So I'm his greatest risk of exposure to COVID-19. So what I try to do is make sure that when I'm in public, I'm wearing a face covering, that I'm adhering to those physical distancing restrictions of 6 feet, and we monitor our health daily. Because if I were to become ill, then I would put myself in a different part of the house from him, and use a different bathroom if I have one available, to try to protect my household contact, my close contact, from getting ill. So that's the type of thing that I would advise that you do, is do symptom monitoring on your household contact if they're out and about in the community, to make sure that they're not bringing COVID infection into your home, particularly if you are vulnerable to those severe complications. So here are some things maybe that have been resubmitted. That one's about deaths. That one's about deaths out of the hospital. That one we have already done. So I think that's it. Whew, that's a lot. So again, stay safe out there. There's severe weather. Please listen to your local broadcast for the information in your area. And we'll be here tomorrow again at 2:30 to provide our update and to continue answering the questions that you might have. So stay safe, everyone, and we'll talk to you again tomorrow.